Good morning. I'm Angela Brower with CBS 4. We do appreciate you joining us today. A big morning for families out there. The CDC just gave final clearance for Pfizer's pediatric COVID vaccine. So now this means 28 million children ages 5 to 11 years old are eligible to get that 2-dose shot. The state of Indiana says it will start administering those as early as tomorrow morning. We also just got an email from the Marion County Health Department, which says walk-ins will be welcome. And right now, the website, the State Department of Health website, is updated. So if you're looking for those locations to get that shot or get an appointment, you can find those locations right now. Doctors have for months been urging people to get vaccinated. But I get that when it's someone else you're having to make that decision for, that becomes a little more difficult. If you don't know who I am, I anchor the morning show here, and I am also a mother of 2 small children. I understand why parents are asking, am I making the right choice? No matter what your decision is, you have shared with me your concerns, your hesitancy, a lot of that having to do with the safety and the long-term side effects of this shot. Now, every time I have questions about the COVID vaccine, or really any vaccine, I turn to a very reliable source, and that's Dr. Veronica Vernon. She's an assistant professor of pharmacy at Butler University. She has worked with the American Pharmacists Association on developing resources for patients and healthcare professionals regarding information about COVID. And she also has her husband, who's a physician. She's a mother herself. In fact, one of her children, she told me, is in this 5 to 11-year-old age group. And so she especially has a very vested interest in everything that's been happening as of late. Now, the point of today is so that you, our viewers, Hoosier families, can feel informed about this. This is your chance. If you have questions about the COVID vaccine, especially when it comes to pediatric doses of it, post them below. I'm going to be on a couple different screens here. I will be asking those questions for you and moderating this forum. First, though, I do want to start with some of the dozens that were submitted beforehand. Thank you, by the way, to those of you that emailed and texted. And Dr. Vernon, thank you for being here this morning. Let's go ahead and start with some of the logistics here. How will this pediatric shot differ from the dose that adults received?
That's a great question. This dose is a third of the adult dose. For the 5 to 11 age group, this is going to be a 10 microgram dose. Those that are 12 and older getting the Pfizer vaccine get 30 micrograms. So this is a much smaller dose. It's also going to be a smaller amount that's given. Just 0.2 mLs in comparison for the adults. We get 0.3 mLs. I got the Pfizer vaccine, and so that's what I would have received. But my son, Max, who I'm planning to get vaccinated because he's 5, will be getting 0.2 mLs and a 10 microgram dose. The differences are there, but then we know one of the similarities is that this child vaccine is given 3 weeks apart from each other. So it's still a 2-dose series given 3 weeks apart. So that has stayed the same, but also the vials are going to look a little bit different. So some people have already been calling me this morning asking, why can't I get the vaccine right away since the CDC signed off on it last night? Great question. It's because the vials are much smaller for children and they're orange capped vials. And that's an important safety factor for those administering the vaccine to make sure they're grabbing an orange vial that contains the childhood vaccine, where the adult dose is in a purple vial. So I do think that's a really important message to give out to all of my colleagues who will be administering that. And then as parents or guardians taking your kids, making sure they're getting the orange capped vial.
Okay, that's all really good to know. We've gotten a lot of questions specifically about the trial size. Now, Pfizer's clinical trial included about 2,200 individuals. From my understanding, there were 1,500 that received the vaccine versus the 700 who received the placebo. So it wasn't a 1-to-1 ratio like maybe we saw in the adult trial, right? But how do you feel about that sample size? It seems small.
Yeah, I think that's something that definitely crossed my mind as a parent, going, well, wow, the adult trials had a lot more people. But I think it's important to note, when I put my healthcare provider and public health expert hat on, is that childhood trials are always smaller. There are a lot more regulations when it comes to testing vaccines and medications in children. And so those trial size may seem smaller, but there's also a smaller percent of the population that meets the requirements for this vaccine. So there were a lot of adults to choose from that could be vaccinated and in the initial Pfizer trials 2 summers ago. But within this childhood vaccine trial that went on this summer, we have a smaller group of patients to pool from. And that sample size is actually quite comparable to what we saw with other vaccines that have been around for years and years and years. That some vaccines has had as few as 300 children in the trials before they were approved from the FDA. And then most are having around 1,000, 2,000, 3,000 children. And the FDA did request that Pfizer do another study after they did their initial study that included about another 2,200 individuals, the 5 to 11 age range. 1,600 received the vaccine, 750 did not. They received placebo. So there is even more information we have after that initial trial of about 2,300 individuals.
And in that clinical trial, what did they find? Were there any major side effects we need to know about as parents?
Great question. That's something that's on my mind as a mom, is what could my child potentially experience? And what we saw, the good news was that this vaccine was about 90.7% effective at preventing symptomatic COVID-19 infections, and that the risk of serious adverse events was very, very small. There were 3 serious adverse events that were seen in the trial, and actually none of them were due to the vaccine. One of the serious adverse events that was recorded was the child swallowed a penny. That has nothing to do with the child getting the vaccine, but that just shows how much data and analysis is going into the development of this vaccine, that researchers are recording everything and they're reporting everything. They're trying to ensure that there is transparency in this process. We did see with children, since they're receiving the smaller dose, and this seems to be the dose that's the most effective at helping reduce the risk of symptomatic and severe infections and preventing adverse events, is that most children experienced arm pain, fatigue, maybe a headache, but those symptoms were far less in children than what we saw in the adult trials, which is really promising.
And I can tell you, you and I spoke earlier last week, and I had gone through some of the documents. I even spoke with a representative from Pfizer, and they had told me no anaphylaxis, no adverse side effects, no myocarditis, which has been a big one, no blood clots. There were 13 cases of lymph node swelling that lasted 2 weeks, 1 case of elbow pain, and some other minor issues. Amy is asking how many people in the United States have died from COVID versus people that have died from the vaccine. Do you know those numbers?
That's a great question. And so the vaccine we know is pretty safe. That the numbers that have died from COVID in the United States is far, 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 far greater. And that's oftentimes when people are looking at the data and saying, oh, well, some have died from the vaccine. Well, some people are looking at the VAERS data, which is the Vaccine Adverse Event Reporting System, which is a great reporting system that we have. But if look at that data as what we call raw data, so it hasn't been verified, it can be confusing, and some individuals use this to mislead the public on how safe the vaccine is, that anyone can report into the system, and it hasn't been verified by the FDA or the CDC. And so additional work has to be done to verify those numbers and actually contribute certain adverse events or death to the vaccine. And so the number of people who have died from COVID-19 is rather staggering. And so if we look at the world, it's definitely in like 17 million. It's a lot of individuals. And then the CDC tracks what's going on in the United States. And so looking at the number of people that have died overall versus anything that's happened with the vaccines, and the death world in the United States are far, far greater than what we see from the vaccine.
And just some hard numbers to give perspective. I looked at the CDC's website this morning. More than 423 million doses of the vaccine were administered in the United States December 14th of last year through November 1st of this year. And that VAERS that you just talked about, Dr. Vernon, received 9,347 reports of death. So that would be about 0.0022% of the people that got the vaccine. We have admittedly reported that COVID symptoms are less severe in children. And if they have a low risk of severe illness, some would say even that the flu is more dangerous. I've heard that a couple times. Why is there this huge push to get kids vaccinated against it?
Yeah, so what we've seen actually is the Delta variant really changed the game when it comes to COVID-19. So initially, when we were at the beginning of the pandemic, if we can think back to March of 2020, is that children were not impacted as significantly, especially in this age range. But over the summer, with the rise of Delta, we saw a steep incline in pediatric hospitalizations from COVID-19. COVID-19 is the 8th leading cause of death in children in this age group, which is very concerning. And that we see that 30% of all children hospitalized for COVID-19 do not have any underlying conditions, which is really scary as a parent to think about, that my child could be hospitalized. And we can't tell who's going to be hospitalized and who isn't now, because Delta is just so infectious and so much worse than our previous variants that we've seen. And so with children, the risk of death is definitely lower and the risk of long-term complications, but children are still getting multi-inflammatory syndrome, which 44% of everyone with that syndrome is a child age 5 to 11. We also see long-term COVID effects are being occurred and reported in this age range. And then there's also the risk of myocarditis from COVID-19. So COVID-19, the infection does cause in certain individuals, it's very rare, but it still can occur in the 5 to 11 age group, myocarditis. So it can cause inflammation of that heart muscle. And we know that myocarditis from COVID-19 itself is far worse than what we see in those cases in the 12 to 17 age range that have myocarditis after receiving the Pfizer vaccine or Moderna vaccine. So one thing to note, I want to talk about myocarditis just a little bit with the vaccine, because I think that's been a really large concern from parents. And I think that's completely justified when you're reading the news and listening to the news, seeing the reports, talking to people in your community. As parents, we don't want to give our children anything that could give them a serious side effect. So with myocarditis, we mainly see it in individuals under the age of 30. That 12 to 17 age range in men is going to be the highest risk from what we've seen from all of the data that's been reported and analyzed. We do think that testosterone plays a role in that. So actually puberty is going to play a role and potentially put a higher risk of myocarditis. We think that risk is far greater in this 5 to 11 age group because there's no true hormone component to it. So that makes me feel at ease. I have 2 boys. My younger son is a year old, so he'll be in the next wave, that 4 and under group. That's all that data is being finalized right now. So within the next 8 weeks, that should be submitted to the FDA. And so hopefully by the beginning of 2022, we'll know if there's an approval for the next age group.
Okay, and I should point out, no one died in the pediatric COVID trial,
no.
So that's optimistic. If you are just joining us live right now, Dr. Veronica Vernon is an assistant professor of pharmacy at Butler University and very well informed about COVID and the vaccine. The CDC just coming out giving final clearance to Pfizer's COVID vaccine for children 5 to 11 years old. If you have questions, post them and we will get those answered for you. A lot of people, so we talked about the short-term side effects. A lot of people, and I'm kind of in this group, asking now about long-term side effects because that's a scary possibility.
Definitely. I can understand why you feel that way. You know, what are the long-term side effects? We don't have much data on that as one of the information that I received, but we do have a lot of data on this. The great news is we know the long-term data for the past several months in adults at least. But when vaccines and medications are taken to the FDA for approval, for full approval, this is talking outside of the emergency use authorization, they typically have 6 months worth of data before they get approved. So we actually don't have long-term data, so years and years of data of safety before they come to the FDA for full approval. What we do know with the COVID-19 vaccine is most serious events occur within the first couple of weeks to a month after receiving the vaccine. That's definitely when we see myocarditis. It spikes usually about 7 days. Around the timing of the second dose is when we see the greatest incidence or greatest number of cases. What we do know about this vaccine is we know all of the ingredients in it. I know exactly what the ingredients are in this vaccine. They've been used in other vaccines and other medications, and they are safe. Polyethylene glycol, which has been a big topic of debate with this vaccine, is safe. It is seen in over-the-counter medications for constipation, such as Miralax. And the dose that's in the vaccine is hundreds to thousands less than what we see in our over-the-counter medications that you can just go buy off the shelf. The other components of the vaccine have been highly tested and we know their safety profile. So when you combine that together, we know that that's a safe product. It's been tested. We have 2 months of data with it before the emergency use authorization went to the FDA, and that was given last Friday for this 5 to 11 age group. And so that data will continue to be developed. And one thing I want to make clear is that although this has been approved under emergency use authorization from the FDA and now approved by the CDC and endorsed, data collection doesn't stop. And so Pfizer will continue to collect data, as will the FDA and the CDC, on the safety of this vaccine, which is why reporting is so important. If you've received a COVID-19 vaccine or plan on getting your child vaccinated, please sign up for vSafe. When you sign up, it will ask you questions daily for the first week to see how you're doing after each dose. And then you'll get periodic text months to weeks after you get it. And so I received my Pfizer vaccine in January, and I completed my series in January, and I still get periodic texts from the CDC to check in. And so that's really important, that we need to collect this data. And you may be thinking, well, I don't want to get this right now, I want to wait. I can understand that as well, that you want to see how it works. But I do think it's important to note that COVID-19 is not going away anytime soon. Unfortunately, what we're talking about now is what's the next variant going to be. With Delta, what we saw is that some folks were saying, oh, you need about 75% of individuals to either have had COVID or get the vaccine to have herd immunity. With Delta, to be effective for that, we actually need about 99% of individuals to have COVID-19 or have the vaccine. And I will point out that the vaccine does infer greater immunity against COVID-19 than having the infection. A report just came out from the CDC last Friday that said natural immunity and COVID-19 vaccination do offer great protection, but it only lasts for about 6 months in each. The vaccine could last a little bit longer, but the immune response was actually greater in the individuals that received the vaccination.
Okay, you're answering a lot of my questions without me even asking you, which is great. For the children that have had COVID, do you still recommend that they get this shot?
Yes,
okay,
completely. There was a report from the CDC that was conducted in Kentucky, so pretty nearby to Indiana. And unfortunately, what it showed is unvaccinated individuals who've had COVID are 2.3 times as more likely to contract COVID for the second or third time compared to vaccinated individuals. So I do encourage you to get the vaccine, your child to get the vaccine if they've had COVID. The important thing is that you just want to wait until that isolation period is over before getting the vaccine. So 10 days if you're asymptomatic, or if you've had symptoms, waiting till at least 24 hours for your fever free, and then usually 10 to 14 days after that. So that's important to note. I do recommend it. There are some studies in adults to show those who have had previous infection and then receive the vaccine have like a super immune response, what I like to call it, is that might be even more effective against preventing future infections and reducing transmission.
Okay, you talked a little about what was in the vaccine, but can you explain what the difference is between a vaccine and an mRNA?
Yeah, definitely. So this is a great question, and I think it relates to why was this vaccine developed so quickly. Someone had commented that polio took 40 years to get a vaccine from the time we discovered polio until we had a vaccine. And so the polio vaccine was first invented in 1955. So many, many years ago. It was a different time then. We didn't have the resources that we have now, and they had to isolate the polio virus and be able to package it into a vaccine in order to administer, which why it took so long. The researchers were starting from ground zero. With the mRNA vaccines, we actually had years and years worth of data. So mRNA, which is messenger RNA, it gives messages to the cells. So it doesn't change your DNA. It doesn't alter your body. It just tells your immune cells how to do things when working in a vaccine. mRNA was first discovered in 1961. So there have been researchers studying this for years, over 50 years worth of information, 60 years worth of information now. And then 1993, we had a clinical trial for an mRNA vaccine. And so researchers have continued to work on this. And what really gave us a boost was the SARS outbreak that happened in the early 2000s. They started working on a vaccine for that, but by the time the vaccine was ready, that pandemic had already resolved. And so they shelved it and continued to work on it and refine it. And so that's why researchers were able to pick up that information and run with the vaccine development. And so mRNA is messenger RNA. It's not part of like an attenuated virus or dead virus that we see in some of the common vaccines we're used to getting, such as the influenza vaccine, where they're taking a part of the virus, they're making that virus inactive. So they're teaching our body how to recognize it. So you're not actually being injected with like the live virus. It's just part of that particle teaching your body how to have an immune response, where mRNA is like giving your immune cells a set of instructions. This is what the coronavirus, the COVID-19 spike protein looks like, and this is how you should fight it, which I think is really cool. It sounds very high tech, but it's actually not. Our bodies contain mRNA that helps code our cells and do different processes. So I think it's really a smart way to create a vaccine vaccine because it's able to teach our body how to do things. And then the mRNA doesn't hang around forever. It teaches our body what to do, and then that vaccine is gone. It doesn't hang around for ages and ages. So I think that's important to note that there were a lot of research behind this. Researchers have been working on mRNA and working on its ability to use in medications and vaccines for years. It's just we haven't heard about it until we needed it. And so I think that's important to note that we also had a lot of resources. The world really came together to create this vaccine, which is unprecedented. It's, I think, pretty amazing and gives me a lot of hope in how we work together during this pandemic, that we had companies working together. So pharmaceutical companies were working together on vaccines, which is really unprecedented.
Okay, I do want to acknowledge Vicki Lucas Duncan is commenting and asking a question about what happened about being tested over the vaccine, why children are just now being targeted when in the beginning they didn't get the virus. Vicki, we did answer your question. I just want to acknowledge that you posted, so thank you for joining us. I would urge you to watch this back in full when you get the chance. Dr. Vernon, you had also spoke about rushed versus speed, and I just want to add on to your comments right there about that, because we saw more people in the trials, right? We saw more money being invested in this, and so that made a big difference in the speed of this and the trials, correct?
Definitely. There was a bigger financial input from pharmaceutical companies for this because they started developing the vaccine, and that's why it's been able to get out so quickly before the approval. So it was sitting in warehouses ready to go as soon as the CDC director signed off on it last night, which is why in some parts of the country, you may hear that children already got their first dose today. And we hopefully will see that tomorrow in Indiana, which is very exciting. I know the Speedway, across the parking lot across from the Speedway, is going to be a big vaccination site where they will have the Pfizer dose for children starting tomorrow. But I think it's important to know that this seems very strange to all of us because we're used to vaccines, especially in healthcare, taking 10 years to develop or more. But I think this is a great precedent to set because it shows when we work together and pool resources, and we have a large pool of volunteers. I've never seen this many people be that excited to participate in a clinical trial, which I think is really exciting. And recruiting participants for a clinical trial can be a very time-intensive step. It can take months and months and months in some cases to get what we call the sample size, the size of participants that the researchers calculate that we need in order to ensure that the vaccine is safe and that it's also effective. And so those safety studies are what we call our phase 3 trials, where we're testing it in up to thousands or hundreds of thousands of individuals. Typically, it's thousands to tens of thousands. And so we have to get a big sample size, thousands of people, to actually detect small differences. And so many people signed up, and parents and children talked about it and worked together to get in these trials. And so the recruitment step actually went much faster than what we've seen for any other medication or vaccine in history.
Okay, and just so you know, if you have not been in the news this morning, Marion County Health Department is already announcing they're going to accept walk-ins as early as tomorrow. The State Department of Health's website is already updated, so if you're looking for a list of locations in Indiana where you can get that pediatric shot, you can do so online right now. CVS, Walgreens taking appointments. I think the first availability I saw for them was on Monday, but just so you know, like, it's underway right now. One person pointed out that we keep reporting doctors are encouraging people to get the COVID vaccine so that we don't get that virus, so that we don't spread it. But Dr. Vernon, you and I both know there have been breakthrough cases. And so what's your response to that?
Yeah, that's a great question. So we are encouraging people to get vaccinated to reduce transmission, because what we do know from all of the data since we started doing the vaccine in December of last year is that vaccinated people are less likely to transmit the the virus, because we're less likely to get the virus ourselves. And so vaccinated people will reduce transmission. An important note about the trials, especially in adults, is we were trying to reduce the rate of hospitalization and severe illness from COVID-19. And so reduced transmission was just an added bonus, really. So we're really trying to reduce the impact on individuals as well as our healthcare system. And so everyone getting vaccinated is going to help get us towards a state of community where we are all working together to reduce transmission. And although some individuals say, well, the death rate is so low. The rate of long-term complications, especially in adults, is creeping up and definitely skyrocketed during Delta. And what we do know with children is that children have a lot of contacts in the community. So they're with their peers in classes, they're with their teachers, they're with staff at the school, they're in extracurriculars, they're with older grandparents, they're with their nuclear family and extended family. And so children can spread COVID-19 quite quickly. And so the rate of transmission among adults and children is actually pretty comparable. But it's important, I think, for all of us to get vaccinated and do our part to protect our communities and realize that in all of our contacts we have in our daily life, we don't know if we're going to come across somebody who is at a higher risk for contracting COVID-19, such as someone who has immune system that's compromised and doesn't work as well, or someone who has another chronic illness that may predispose them to that. And so I think it's important that this is why it's called public health, that we're trying to protect the public and our communities.
Okay, you lead right into my next question. We've had a couple people asking about specific conditions, and I might just group these together. You can answer them all, or if you want to separate them, that's fine. Maureen wrote in and said her daughter is extremely high risk. Would her reactions or side effects be any worse than someone with a typical immune system? We had another person asking, my child's on medication for Tourette's, which is of course a neurological disorder. Could that vaccine have a negative effect on her neurological system? We had one person asking about how this could affect lupus. We had another person asking about asthma in a 9-year-old. What do you say?
Yeah, great, all great questions. First, I would encourage you to talk to your child's pediatrician or their specialist that they see, if they see one for one of those conditions. I think this is a really important conversation to have with a healthcare provider that you trust, who has read the data. Ask your healthcare provider, are you up to date on the trial data? Have you looked at the Pfizer documents? Did you read the CDC and FDA briefings? And have an honest conversation. I really appreciate all these questions. And I just want to first start off by saying that asking questions is so important in healthcare. I think it's important to know what you are agreeing to and what treatment or vaccine that your child is getting, and asking about the side effects, asking about, has this been studied in children with my child's condition that are like my child? And in the clinical trials, these children were free of any major chronic conditions. So that is one thing to note, that when we open this up to the general population, this is why sometimes we see a higher rate of adverse events than what we saw in the trial, because we're now opening this up to 28 million individuals that are eligible for vaccination, and just instead of 2,300. And so with your specific conditions with your children, talk to your healthcare provider. But I would encourage you that if your child has a condition that puts them at a higher risk of COVID-19, such as asthma, I definitely encourage vaccination. What we do know from the adult data is that those who are immunocompromised typically don't have worse adverse effects from the vaccine. But their immune response is blunted, which means that they may not have as much of protection against COVID-19 as somebody who doesn't have that condition. So a great example is there was a study of immunocompromised individuals and those that we call immunocompetent individuals, those without any condition that makes their immune system work a little bit less. And what we saw in the individuals that had their immune system fully functioning, didn't have any conditions that compromised that, their protection was well above 90% against severe COVID-19 infections. In immunocompromised individuals, that dropped to 77%, which is still really great. That's better than the flu vaccine. And one thing I want to point out is that COVID-19, actually hospitalizations, your risk of ICU admission, even for children, is far greater with COVID-19 than with influenza. And so that's promising for me to know that we do have data on adults that are immunocompromised that have received the vaccine, which is why now those that are immunocompromised adults 18 and over, we do recommend getting a third dose or a booster vaccine, regardless if you've received Moderna, Pfizer, or Johnson & Johnson. We do recommend that, and you can mix and match boosters. For children, that data hasn't come out yet, looking at immunocompromised children, especially those that are 12 to 17. That information hasn't yet come out from our trials, and so there's still more work to be done on that. And that 5 to 11 age range, we won't know for several months because they're still looking at that 12 to 17 age range. But I do think it's important, and I would encourage you to talk to your healthcare provider to get their recommendation and to make that decision jointly, as this is your decision that you're making for your child. But if it were my child, I would definitely get them vaccinated, because I think those conditions put them at a higher risk of contracting COVID-19. And I think the side effects of the vaccine are going to be far less and much safer than contracting COVID-19.
Okay, we have a couple more questions and we're going to wrap it up here. It doesn't sound like then you'll anticipate any boosters just yet for that younger age group, correct?
Correct. Not yet, but more to come. This could be, everyone gets a booster shot or a dose every year, just like we do with influenza, but that data is still coming out. We're still looking at it.
All right. We had one person ask about the 5 to 11 age-year-old factor. She has a 4-year-old that is more the size of a 5-year-old, and I can probably answer this for you. When you go onto the website to say like, hey, I want to get a COVID vaccine, most places are going to ask for your birth date before you make that appointment. And so, Dr. Vernon, correct me if I'm wrong, but it's pretty strict on age, correct?
Correct. So it is pretty strict on age, and people may ask why. Some of you may be familiar with weight-based dosing for medications for your children. So if you get Tylenol or ibuprofen over the counter, it's dosed based off of usually your child's age and weight. I have a son who just had ear tubes put in yesterday, and we were giving him Tylenol after that surgery, and we do it based off his weight. So I calculate his weight and determine what dose he gets. So why don't we do that for the vaccine? Great question. Well, it has to do with the child's immune response. So in the Pfizer trial, they actually went down to 6 months to 11 years old in this trial. They just submitted the 5 to 11 age range to the FDA. They tested different doses. And what they found is the 10 microgram dose worked the best for all 5 to 11-year-olds. It reduced the risk of side effects and also maintained a great immune response, similar to what we see in teenagers and adults. And so that's why that dose was picked, and that's why it's 5 to 11, because that group is what showed the best response. 4 and under is actually going to have a smaller dose. And so your child should get vaccinated based on the age that they are, not on their weight. And so if you have an 11-year-old that gets vaccinated next week and they're going to turn 12 in 2 weeks, they could get the adult dose as their second dose, or you could also give them the pediatric dose, the 10 microgram dose. That's not considered to be incorrect. And so that's a conversation that I would have with your healthcare provider, with your pharmacist, with your physician, your nurse practitioner, your PA, whoever that your child sees and receives their vaccine from. I think that's a great conversation to have, but we actually don't do it based off of weight.
Interesting. Charmaine is asking which is the best vaccine to go with, Johnson & Johnson or Pfizer. But let's be clear, only the Pfizer vaccine is approved for children 5 and up.
Correct. That is correct. So right now it would be Pfizer is going to be what we're focusing on for this 5 and up age range. And then I think if you look at the data, it just depends. I think Pfizer and Moderna have had a little bit better immune response. And especially if we're looking at women, especially younger women, Johnson & Johnson has a rare side effect that's related to a blood clot. And so that's something to consider. It's very rare, but it can occur. And so that's a great conversation to have with your healthcare provider if you are above the age, of where you could receive Pfizer or Johnson & Johnson as an adult. But for 5 and up, Pfizer only, as of right now. Moderna is working on their trial results and shoring that up to get that to the FDA. So Moderna should be a little bit behind Pfizer.
We're hearing January. I know there were some delays as far as that goes. We've had people asking about schools and whether our schools will be mandating this kind of shot. I did reach out to the Department of Education. They told me that vaccines are strongly recommended in eligible individuals but are not mandated by the state. It's sounding like it'll depend on school boards, school districts, if and when that time comes. But how do you feel about that potentially happening?
Yeah, I think that's a great question. And so you think, well, it's great if everyone can get vaccinated because that's going to provide extra immunity and keep our schools open. As a mom of a kindergartner, I want him to go to school. That social component is so important being in person. And I applaud all the parents that have done virtual school for over a past year and a half, nearly the past 2 years. That takes a toll on children. We have to think about their physical health, but also their mental well-being. They want to be in class. And my 5-year-old's really excited about the vaccine. We've talked to him about it. We've watched a lot of videos together to help him understand as much as he can at that age. But when it comes to mandates, I tend to agree with what the FDA Vaccine Advisory Board said last week, that it's still too early to mandate this vaccine for that 5 to 11 age group. This emergency use authorization is fresh. And so I do think we just need to try to get the vaccine into as many arms as possible for those who are willing, and have those conversations about mandates at a much later date. I think this is a conversation that you need to have as a parent with your child's healthcare provider right now. So that's my personal opinion. But I do think it's important that you do consider vaccination. And if you are nervous about it or hesitant or have concerns, please talk to someone who's a healthcare provider that's read the data and analyzed it and has expertise in analyzing all of this information that you feel comfortable with.
If a child does get vaccinated, though, can they drop the mask wearing? Could we see schools dropping that mask requirement?
Potentially. We could see schools dropping the mask wearing. I will say it will just prevent, it will also depend on community transmission. So, last summer, I think we all think back to how the mask mandates were really lifted in some areas, and then Delta happened. So now, vaccinated individuals still should wear masks to protect others. But I think if we see our vaccination rates increase significantly throughout our communities, those mask wearing mandates in schools and other public places could start to be lifted.
My last question for you is kind of a next step. Babies and toddlers, when could we see a vaccine come out for them?
Great question. That's what I'm waiting on, because my second son just turned 1. And so we're looking, as Pfizer is finalizing that data, it probably will be submitted to the FDA for review by the end of December. And so early January, February is when we're anticipating an announcement about the vaccine being available for those 4 and under.
All right. Dr. Vernon, thank you so much for all of this information and for joining me today. I really appreciate it.
Yes, thank you. Thank you so much. And thank you to everyone that asked questions and continues to ask questions. I think that's really important to have these conversations.
All right. CBS 4 and Fox 59 will be following the new developments all day. You can catch more on our newscasts and 24/7 online at cbs4indy.com and fox59.com. We hope you have a fantastic day. If you have additional questions, please feel free to reach out to me, and I will try to get in touch with Dr. Vernon at a later date.